from XR today, bringing you the latest in news and conversation from the extended reality space. Today I'm joined by Richard S. Hart, an expert from the healthcare field who is using XR to upskill the field's professionals today. I just want to thank you so much for joining in today, Richard. It's going to be great to get your insight and your knowledge. Just before we kick off, because it's going to be quite a loaded topic today, could you give us a little bit of a background into your experience in healthcare and more precisely that crossover when you decided to use XR in the manner NextGen Surgery are today?
Yeah, certainly. Well, first of all, thanks very much for having me. I'm glad to be here and I'm glad to be able to help out and impart any type of knowledge that I can to help move the field forward. For me, I've been a surgeon for 25 years, hepatobiliary, pancreatic, and general surgeon, and set up a center of excellence in Toronto uh, by Cancer Care Ontario. They designated us that. But throughout my entire time as an educator, I knew there were things that we did exceptionally well in surgical training, but that there were areas where I wouldn't say we fell short, but we've never really trained them. So surgical education primarily focuses on skill acquisition and execution, ultimately leading to technical mastery and autonomy through neuroplasticity, right? We develop automaticity of our skill. But that's actually only one piece of the puzzle in performance, because the harder skill to develop is the ability to self-regulate, to create a calm mind, to enhance your performance. That's just assume that people have that happen over time, and the research shows that it doesn't. And so what next-gen surgery is, and why I sort of had made this switch, is for the first time in 100 years, surgical education is actually changing from an apprenticeship model to one of a competence-by-design model. So it gives us the opportunity to create a new curriculum uh, in an era, or that's meeting an era, that has technologies that we've never had available to us. And so for me, I've sort of left the operating room to transform, hopefully, everything that happens within the operating room or leading up to it, to evolve how we look at and train surgeons for the future. So adding in biobehavioral, cognitive, and physiological regulation and training to be able to um, control your internal environment in the face of a constantly changing internal and external environment. So probably 2017, when I saw the HoloLens for the first time, I knew I could do it. I'd been wanting to do it for a decade before that, but it's been in the last year and a half, that I left practice, and I'm doing this full time now.
But going off your notes there on surgical training, healthcare training, and perhaps using new emerging technologies to secure new innovative avenues there for learners, could you perhaps tell us a little bit more about the demand and perhaps what skill gap or perhaps technology gap you're trying to answer with this new next gen surgery endeavor?
Certainly. So, in terms of the skill gap, I would say we have the technical skills. I mean, we're excellent at that, as I said, but the gap comes in teaching and training in self-regulation. It's only been in the last decade that people have really looked at what we call the non-technical skills, or people refer to them as soft skills. I call them power skills because they're actually the harder skills to develop. And so we've done things like everything that we've done is subjective in nature, and it's based on self-perception and self-reporting, to be able to try and transform how we perform within ourselves. With next-gen surgery, I've taken a page from my previous career when I competed internationally for Canada in sport, and I was fortunate enough to learn about applied psychophysiology and neurophysiology and electrophysiology for assessing your abilities to be able to create this calmness of mind with the confidence to perform in any environment. So that's what I'm trying to address, or to bring into surgical training. And the reason for that is that stress, and this is really, it's about stress mitigation and stress inoculation to develop stress resiliency. We know that, about 3 million people a year suffer a complication as a result of lapses, uh, preventable harm, really. And that amounts to about $606 billion per annum to treat. Half a million people of those 3 million die in the immediate postoperative period. And so, what I'm trying to do is address this, the human factor aspect of training that we can now um, bring a new approach to with these immersive and interactive technologies that we didn't necessarily have before.
Fantastic. And then focusing on the not just the professional side there, but also the patient side. Um, when it comes to these sorts of solutions, there's various ones to help ease patients in healthcare, as well as what you're doing here for professionals. But going to the technology side of things, and we're going to get deep into that technology stack here. For both healthcare professionals and patients, how are those data? How important are the data points and some of the accompanying metadata that comes with this new innovative training that you're rolling out, and how are you working towards providing those data points as something valuable for professionals, or perhaps their decision makers, managers, etc.
Yeah, a lot of questions in there, so I might ask you to repeat a couple of them
Of
again.
course,
But
of course.
really, it is, as you say, it's about data. So NextGen Surgery is about human factors, critical moments, and data science. So we know that when we talk about precision medicine or digital precision medicine, which is the era that we're in right now, I see it in two ways. I see it as forward facing, in which the patient will interact with a device and achieve or hopefully gain a positive benefit as a result of that. Any of the wearable technologies or just a digital health platform, especially for mental health and things like that. The way I'm looking at it is actually taking the digital health strategy and turning it back onto the surgeon, the OR team, the nurses, and everything like that, and upskilling using neurotechnology and brain computer interfaces to then give a positive impact to the patient in terms of improving safety and hopefully outcomes. And again, it's very different what we're doing here, given that it actually is objective metrics that we can assess, we can then target and specifically train them. So we have a metric to know, that training A is actually occurring. We're able to identify what's working, when it's working well, or how well it's working. And we're able to then provide transfer skills based on this data to take into the operating room or to move from the non-performance environment to the performance environment. So the performance environment being the operating room. I mean, right now the Olympics are on. It's the exact same thing, right? I mean, it's a mind game and it's a skill game, and you're never sure uh, how things are going to go. We can get into an ideal performance zone, which is what we get everybody to. I mean, when you assess them, we can tell when you're at baseline, stress, and recovery, right? We can tell how you're going to react pretty much in any situation. And then with that, we can target training that is specific for the individual and not try to just put people into a category and where everybody's learning the same things or perhaps given a few different techniques, but it may not be working. So by this, we're creating a really an individualized approach to enhancing performance uh, at the level that's never been truly addressed before, right? We do things at a systems level, and now we're just bringing it down further, right to the human, which is um, the standard variable, right? I mean, that's the surgeon and the OR team are the one variable that never changes in the operating room, right? Things can change moment to critical moment, but the team is the same. So this is now about going deeper and looking at the team.
And you mentioned some of the technologies, some of the bits within the technology stack there, which I want to dive into deeper. And you answered my question beautifully, so thank you. The other side of things too, where it's this idea of taking wellness, stress management services, digital services, and these digital training services, and bringing them together. Would you say it's fair to say that that can bring value not just to healthcare, but that could potentially bring values to various other scenarios? just potentially where these XR training methods are being executed.
Absolutely. I mean, there's the reason I'm starting within surgery is because it's an area that I have domain expertise. And we have to look at this technology or what we're bringing. It's not necessarily a technology, it's a solution. Right? It's a hardware software solution that can be integrated into any domain where performance under pressure matters, where stress has a direct impact on technical and non-technical skills. That doesn't have to just be in healthcare, and where burnout and mental health issues are you know, on the rise. I mean, right, where we have a global epidemic in with addiction and mental health issues, and the training inherent in these types of in the type of training that we do, or the benefits through neurofeedback and biofeedback, they have direct positive effects on both mental and physical health. And so, not only are you going to improve an individual's performance, but you're going to improve their overall well-being. And you mentioned wellness, but it goes anywhere where performance matters, right? The DNA of performance is the same regardless of the domain.
Really well said. And let's get into some of these technologies you're mentioning, because when it comes to neurotechnology, BCI, less so AI nowadays, but these are quite new and unapparent and unknown technologies for a lot of our readers who aren't working in healthcare, etc., etc. Break this down for us. What are some of these technologies you're using?
Sure. So, I mean, the first thing I think we need to talk about are, everybody's talking about BCIs, brain computer interfaces, as if they're they're the newest thing. I mean, they've been around for a quarter century, right? I mean, in fact, the company that I'm working with, G-Tech Medical Engineering out of Austria, I mean, they made the first brain-computer interface back in 1999, and they're a global leader in this. And what we're using is, I mean, this is a medical grade, FDA approved, Health Canada approved, European approved um, electroencephalog EEG device, 32 channels, but it has an amplifier that also has cables for all of the body metrics. So we're able to take, all of the brain measures that we want, all of the body measures, and be able to extract that data moment to moment. And with with BCIs and being able to see how things are changing immediately, it's not it's not actionable data that you look at after, but I call it's data in action, because you can actually learn how to transform or change in the moment. And so by doing that, we're creating this new performance platform. I mean, I shouldn't say we're creating a new performance platform. It's new in healthcare. This has been used in part in other domains where peak performance under pressure matters for decades. I mean, again, I learned and knew about this dating back to the 1980s in sport. I was fortunate enough that our mental performance coach used these types of things. So it's been around for a long time, but only now is it sort of coming into the healthcare stream, and still people look at me when I speak about it, and they're not certain, they don't necessarily buy into it right away until you really start to explain what applied psychophysiology is, and how through um, EEG or neurofeedback and biofeedback, you can really target something specific, so attentional focus or distraction control and the ability to refocus, you know, mental imagery or motor imagery, and that we can actually measure and train and see how someone's doing, or we can identify a level when somebody reaches true expertise, right? Where through automaticity, because there are changes within the brain that an EEG can actually measure. And again, I need to say, this is non-invasive. Everybody, when they hear about BCIs and stuff, they're thinking about implantable devices. This is not that at all. This is a device that, or what we're building, is not going to be quite um, a, as big as this, right? It's going to be something that's much smaller that you're going to be able to wear quite easy, less than 120 grams. It'll fit under a surgical cap. It would fit under a baseball cap. But it's going to be able to measure the specific data that we need and help you to train using these brain-computer interfaces.
And just rolling off the back of the idea of a non-invasive BCI, applicate or hardware. Obviously, some firms, Meta, Samsung, for example, are coming out with rings with biometric data and loops like that. It almost feels like it's a whole new language that's being made when it's integrated with VR. In terms from the data.
Yeah. Okay. So, I mean, first of all, you're right. I mean, when we look at the immersive technology that we have available to us, and I would be remiss if I didn't say that it needs to be immersive and interactive, right? You can't just use the mind because from here down we have a body that responds as well, right? There's a physiology within there, and so it's important that you need to train the mind to respond to the body and the body to respond to the mind, right? So that you're integrating your central and autonomic nervous systems in the service of self-regulation and adaptability. And now, while people can take, um, wearables are all they're the new thing, and they are, I believe, the most exciting area of um, you know healthcare or precision medicine and diagnostics and therapeutics that we have. Some people call it the Internet of Things. I like to call it the Internet of Surgical Things because of what we're actually measuring. Everything in the mind and the body. We can't read your thoughts. I mean, let's be honest here. We're not doing anything like that for those who think we are. But then using machine learning and AI, that's when you're able to train outside of measuring. So all of the wearables that we're talking about, the rings and things like that, they're collecting data and they're able to present that data. But we're then taking that data and creating specific training programs based on proprietary data to be able to improve you. So that's where the big difference is. It's not just having the data, it's then being able to train it with objective metrics.
Fantastic, and that's all of this put together, technology, the actual sector of which you're applying all of that integrated technology to. It's a very unique perspective, and it could easily be a indicator into how these training applications serve workers in the future. So my question to you to wrap this up, over this year and a half, and then perhaps that elongated journey to getting here with NextGen Surgery, what lessons have you learned? What challenges have you overcome? And perhaps can you pass on to other individuals integrating or perhaps creating XR training in other professional sectors?
I would say, despite this, it's been, I would say, a decade and a half journey that started a year and a half ago. Um, I would say at times it's easy to allow your ambition and your what you believe should be able to happen, um, to have that actually be come to fruition where we are now. The HMDs that are out there are phenomenal. The handheld devices, I would say, are lacking. I use robotic haptic feedback from another company because we need the precision. I think whenever you're using these technologies, it's really important to recognize the importance of exactitude and embodiment. And it's something that people forget about, I think. So they'll be doing something in a virtual world and they'll be moving and doing the technique, but that doesn't necessarily translate into what you're going to then be doing in the environment that you need to be in. And so by creating immersive environments that are hyper realistic, that truly is the key to be able to then transfer, that sort of XR to performance environment moment. The transferability is predicated on embodiment and exactitude. And I'm not there yet, but I'm excited by all the work that's being done in the field. I mean, I see new things every single day, and I'm one voice. Uh, I believe it's a unique perspective, but it's not the only perspective. And I hope that by what I'm doing can be incorporated into any of the XR platforms that are already out there. right? Because they're doing skill. This can sit on top of it and add that new performance metric that's missing with data analytics.
Brilliant. Great. Thank you so much for all of that information. I really appreciate your insight. Thank you so much for joining me today, Richard.
That's my pleasure. Thanks so much for having me.
Brilliant. Thank you so much. If you want to get more XR news, please follow the news site and the YouTube channel. Cheers.